Okay, good afternoon, everybody. We appreciate you sharing this time with us. We're really excited about our presentation. We are very excited to collaborate together to bring this to you and talk about balancing privacy and collaboration. We do ask that all questions are held until the end of the presentation, until we can get through all of our information, because this is a collaborative effort. And so we are going to have a Carilion side and then a Virginia Tech side, or a covered entity and non-covered entity side. So if you will just hold questions until the end, we will be happy to answer them then. And so again, we appreciate your time and we're glad that everyone is here, because we're all here to basically share our passion for people. Today, we're going to be talking to you about sharing information and data. And excuse us for doing that, because at the end of the day, it's about people. And we're in a world now to where we're inundated with information. We're used to getting data so quickly, to where we're going to talk about how to exchange information. But at the end of the day, it's about the protection of our patients and our participants. And again, just supporting people in general and the advancements in research. And so to start it off, like any good collaboration, we're going to talk about our principles. And so from the Carilion side, one thing that I'm sure several of you heard is our mission and our core values. But as part of the vision, I wanted to highlight a very specific one, that part of Carilion's vision is patient-centered research. And so we take it very seriously, and patients is always top of mind for us. And so that is something I want to emphasize as we talk about the protections we put in place for that.
And then I'm Julie Cook, and from Virginia Tech side, we want to talk about, if we're conducting research at Virginia Tech, it's important as a researcher to really think about how your research aligns with Carillion's mission. So, as Hillary was saying, we're not just asking for data. We want to make sure that we're thinking about the mission and begin our collaboration process with clear understanding of how it aligns with the vision of better patient care, better community health, and lower cost.
So some important terminologies and definition that I wanted to point out today is the three on the screen before we start talking about the laws and regulations. But when we talk about privacy, we're talking about the aspect of representing people. It is their right to be left alone and limit their access. So privacy, again, correlates to people. When we talk about confidentiality, we're talking about the stuff that represents the data, how to get it. Once you have it, is it remaining confidential? What did you do afterwards to destroy it, to again maintain that confidentiality? And at all costs, a study team and a researcher, basically you're trying to do everything and plan to never have a data breach. And I'm not going to get into that too much, but again, that's at the bottom, because that is the goal, to not have a data breach.
Thank you, Hillary. Good morning, everyone. Katie Tomlinson here from Carillion's privacy office. To echo what Hillary said, we ethically are bound to protect patients' privacy, but we also are legally bound to protect patients' privacy. So we're going to jump right in to define HIPAA's privacy and security rule. So the privacy rule sets the minimum federal standards and regulations that protect patients from inappropriate access, use, and disclosure of their protected health information. Who does the privacy rule apply to? It applies to our health plans, healthcare clearinghouses, and healthcare providers, all three of which are considered covered entities. So Carillion, being healthcare providers, is a covered entity. The privacy rule also requires appropriate safeguards to protect privacy of PHI. It also sets limits and conditions on the uses and disclosures of PHI that can be made. So with this bullet point, we're really talking about uses and disclosures when we don't have a HIPAA authorization from a patient. And so those limits and conditions include disclosing for business purposes, for treatment, payment, healthcare operations, and then we have our IRB approved research studies as well. And in regards to limits, even when we have HIPAA authorizations or waiver of authorizations from the IRB, or we have, or we don't have a waiver and we're working under those business conditions, we still have limits. Our providers, our practitioners cannot just go in and access anything that they want. It has to be the minimum necessary to do whatever their job role is or to achieve the business purpose is that we're dealing with in each scenario. In addition to those limits and conditions, the HIPAA privacy rule also gives rights to our patients over their PHI. That entails patients having the right to request and obtain copies of their records. They can request amendments and changes to the records, and things along those lines. And the HIPAA privacy rule does not only apply to the electronic medical record. It includes paper documentation, the electronic records, and verbal communications about PHI. And then in addition to the HIPAA privacy rule, we have the HIPAA security rule. So the HIPAA security rule establishes a national set of security standards for protecting electronic PHI, and it operationalizes the protections contained in the privacy rule. As the privacy rule states, we have to have these safeguards, and the security rule addresses what those technical and non-technical safeguards are that covered entities are expected to have into place. So those safeguards include administrative safeguards, physical safeguards, and technical safeguards. And so for administrative safeguards, that includes security management processes, security personnel, information access management, training and evaluations. Our physical safeguards include facility access control, when we have our badges to badge in, workstation and device security such as passwords, privacy screens if your computer is facing a lobby and we don't really have any other way to point that computer, things like that. And then we have our technical safeguards, which include access control, audit controls, integrity controls, and transmission security, all really crucial elements that Carilion as a covered entity must have in place in order to comply with the HIPAA security rule.
Okay, so with all of these things in place and abiding by the law and regulations, all institutions have to establish a privacy board. So at Carilion Clinic, the Institutional Review Board serves as our privacy board as well. They have oversight, and they also review and approve any request of waivers of authorization and any disclosures where PHI is being used in a study.
So an important part, if you're coming from the Virginia Tech side about who must comply with the HIPAA privacy rule, it's important to note that Virginia Tech is not a covered entity like Carilion. So data collected by Virginia Tech researchers are not regulated by HIPAA. They are regulated by federal and state laws. And so they do require protection, but it just is important to note that it isn't regulated by HIPAA. Virginia Tech has entered into some business associate agreements in a few instances. In these cases, a business associate is required to comply and is regulated by HIPAA. But typically, when we're talking about research, conducting research is rarely considered performing tasks on behalf of a covered entity. So this is not a recommended path generally for research activities. And so then this next slide is along those lines too. So, when we're talking about the tasks a business associate would perform, things like billing and claims processing, quality assurance reviews, it's rare that research activities are actually under the task involved with a business associate.
now that we've reviewed the regulations that are in place with HIPAA and understanding the differences between covered entities, non-covered entities, and how business associates are also required to comply with HIPAA if they're doing the work on behalf of a covered entity, we can talk about how Carillion implements different processes and safeguards in order to comply with these regulations. So Carillion has implemented a role-based access control model. So what does that mean? That means that access to Carillion's PHI is granted in accordance with specific responsibilities and designated functions of each employee or collaborator. So not all employees have access. It is strictly related to what your job role is or what your responsibility is as a collaborator. So key point there is to outline it in your research protocols. With research and with collaboration, the protocol serves as our outline for the role-based access. The protocol is stating what your responsibilities are in the research study, what data storage we're using, what data you need access to be able to execute the study. And so all of those items serve as purposes for us to be able to establish what the role is and what the appropriate access is to be able to execute this study. And in addition to, the access piece, we have outlined various trainings and or documentation required prior to gaining access to PHI for research. That includes signing our access and confidentiality agreement for employees and collaborators. That can include contracts for collaborators outlining scope of work and things like that. For students, we have an formal onboarding process through our visiting student affairs, whether that be Carillion's visiting student affairs or VTCSOM's visiting student affairs. So all of these pieces are crucial to ensure Carillion is complying with the HIPAA privacy and security rule. This can fall under our administrative safeguard as processes to grant access to our information, and can fall under, our information access management safeguard. And then another key point that we'd like to go over today is that access to Carillion Clinic's PHI is a privilege, not a right. We are always working to ensure we are complying with these regulations and make sure we are protecting our patients at the end of the day. And so now that we've, talked about, our policies on access, how do we get to sharing the data? So Carillion has various electronic environments where data can be housed, whether that be Epic, Spark, or Secure Research Environment, REDCap, Secure Drives, and then we also have Trinetics. And so these are data storage areas. So each data storage environment you are wanting to use, and then the necessary accesses to these environments required for your protocol or for your study must be defined in the protocol. And then it's up to the principal investigator to ensure that what you've outlined in the protocol, what you're requesting, is truly the minimum amount of access that is required to be able to accomplish the purpose of the study. And so once we have the granted access and we've got the protocol approved and you're doing the study and you have access to these environments, we do have a process for continuing access to these environments, which includes our renewal process, which ensures that we have the appropriate approvals, whether that be continuing review approvals, making sure we have the appropriate levels of access have continued, and that the personnel hasn't changed, and that the relevant training and agreements are up to date, including signing the ACA annually and things along those lines. If you have questions about the continued access and our renewal process, we have those outlined in our secure data sharing policy and our access to ePHI policy for research as a resource to you all if you have questions along those lines. And then, once we have access and you're doing research at Carillion, it is important to note that whether you're an employee or a collaborator, you do have a duty to report any privacy or security concerns to Carilion when you're collaborating on Carilion, with Carilion on studies and it is involving Carilion data. So any researcher or collaborator who identifies a potential HIPAA breach relating to research activities should notify the Carilion Clinic Privacy Office. We've got our email up here and our phone number. And then also you are responsible for reporting it to the IRB of record as soon as possible. Carilion, as a covered entity, has time-sensitive reporting obligations that are driven by the date that a breach is considered discovered. And so what does that mean? A breach is treated as discovered as of the first day of which the incident is known to any workforce member or agent of Carilion. So if we have a collaborator that identifies a potential concern, and you wait to notify the Carilion Privacy Office, we are putting ourselves behind the 8 ball because we have those time-sensitive reporting obligations. So it's really important for, if you have any sort of concerns, to report it right away. You're not responsible for determining whether a breach occurred or not. That's the responsibility of the Privacy Office. So you just give us as much information as you have regarding any sort of concern, and then we will take it from there, make sure we do a thorough investigation to confirm whether a breach occurred or not. And then if it has occurred, we have reporting responsibilities to the Office of Civil Rights. And so we're here as a resource for you, and we are here, to protect our patients' privacy and ensure we are complying with these regulations. So please don't ever hesitate to reach out to the Privacy Office if you have any questions or concerns about HIPAA or a potential breach. And so, with regulations, we always run into risk of non-compliance. And so what does non-compliance with the privacy and security rule look like for Carilion as a covered entity? So we run risk of harming our reputation if we're not protecting our patients' data. We can run into disciplinary actions with our staff, and then it can go as far as to epic access block, and that can apply to employees and collaborators. We can be looking at regulatory enforcements, sanctions, licensing board actions, fines from HIPAA up to $1.9 million, depending on the severity of the event, civil action suits, and criminal penalties. So all of these efforts that we have in surrounding, our policies, our role-based access control models, our policies on data sharing, all of these are to ensure we are complying with these regulations and we're not going to be running into these, unfortunate scenarios of non-compliance.
So as we just got done talking about, and Katie talked about secure data sharing, it is important to note for planning purposes that Virginia Tech and Carilion does have a reliance agreement. This agreement basically means that Carilion Clinic's IRB will be the oversight authority for any research that takes place for patients and patients' data, and Carilion employees and Carilion facilities. Virginia Tech and IRB and Carilion Clinics IRB will work closely together, and there's a formalized agreement, but Carilion Clinic does have oversight authority for any research that uses the data and what we've previously talked about.
So for the next few minutes here, we're going to talk about the different pathways that a researcher could use to move information from a covered entity over to a researcher at Virginia Tech. So the colors on the slides here are important. You'll notice that on the left side, a covered entity, is in the maroon, and they have and hold their protected health information regulated by HIPAA. But then there are some processes that can be used to move the data over to a non-covered entity, which would be a Virginia Tech researcher. And when the data comes over to Virginia Tech, that information is then subject to state and federal regulations and university policies. And is not, when you follow one of these pathways, is no longer information regulated by HIPAA once it's held at Virginia Tech. And I'll go through each one of these in the following slides. So the first way is to de-identify the data set. So in order to do that, we remove all 18 HIPAA identifiers or statistician expert determination and documentation where a statistician determines that the data could not reasonably be used to identify an individual. I think where we get a little caught up with this is it can sometimes, depending on the data you are needing for your research questions, to just remove, the name of the person. But the 18 identifiers, their dates are in there, dates of service, which are often really important for using for research, to answer research questions. And one of the 18 HIPAA identifiers is anything that could possibly lead to the identity of an individual. And when you use that language, people start to get nervous that there could be something left in that data set that if you tried to, you could re-identify. So it isn't always as simple. And I think in our collaborations with Carilion, we have to think about who's doing the de-identifying, what do you need to include in your proposal for cost of that and the timeline of that, and is it feasible to answer your research questions with a de-identified data set? But once you do this and you remove all 18 HIPAA identifiers, then the data can come to Virginia Tech and minimal regulations apply at that point. But university policy certainly does apply on protection of the data. And then another option is what we call a limited data set. And with this, you remove all the HIPAA identifiers except for location, like city, state, zip codes, and dates. And dates can be date of birth, date of, like I said, date of treatment. And so sometimes those are required in order to be able to answer your research questions. But if you want to obtain the data and leave those in, we can work with Carilion to obtain a limited data set. And it's a data use agreement that's executed between the covered entity and Virginia Tech. And it spells out specific provisions that we have to meet here at Virginia Tech on how we're going to protect the data once it's here. So the data once it's here is then subject to the terms of the data use agreement and the federal regulations. Common rule, we would consider IRB at Virginia Tech. It typically would review this before a researcher would have to review this before a researcher move forward with the project. Next slide. The next one is assigned patient authorization. So this type of pathway works when you have the research participant, you already know who they are, you're talking with them as a researcher face to face or on Zoom, and you are already interacting with them. When you're at that point, like maybe you want to recruit them to come into your lab and do some testing in your lab, at that point, if your research questions require medical information from their medical chart or from Carilion, you can ask the participant at the time of consent to do assigned patient authorization. And so they sign this authorization that includes core elements that are in required language that HIPAA regulates, and that authorization is maintained by the covered entity. So the patient consents and enrolls in an IRB approved study, they sign the authorization, and then the data can be used here at Virginia Tech by the researcher. The information is subject to state and federal regulations and university policy once it's here. And those federal regulations include the common rule, the IRB, like I said, an IRB approved study. Next one. Another pathway is a HIPAA waiver of authorization. So with this, the IRB must review and approve. This would be a study where it isn't possible, and the IRB has to do a review and document that it's not possible to do the research without obtaining this waiver, or without, it can't be conducted without using protected health information. So it can't be de-identified. We can't go the route of a limited data set. And then I think Hillary's going to talk more about all the requirements. This is not an easy, just because you're a Virginia Tech researcher and you have, and your IRB has given you a waiver, that does not mean you can take that waiver to any covered entity and say, oh, I have a waiver, I'd like to have the data. typically this is going to go through the Carillion IRB, and this is a lot more difficult to document that, that the identifiers you have wouldn't cause any harm to the individual. And like I said, I think Hillary's going to go a little bit more into this in a future slide. But once the data comes, here to Virginia Tech, then the information again is subject to state and federal regulations like the Common Rule and university policy.
So as Julie mentioned, we wanted to illustrate here that this will fall under the Carillion Clinic IRB and the Privacy Board. Any way that this is granted is only by following the 3 criteria that is on the screen. You'll notice that under number 1, there are specific sub-bullets that the IRB has to see thoroughly explained within a study submission. And so the key words that I want you to focus on in the sub-bullets is where it says an adequate plan to destroy, to protect, to where the research teams have to thoroughly explain how they have came up with the plan and explain how they are not only going to use or disclose the PHI, but also how they're going to maintain it, destroy it, and written assurances that it will not be reused or disclosed in any other way. The other 2 criterias that have to be met, again, is like Julie mentioned, the research could not be conducted without the waiver, and also it could not be conducted without the access to the PHI. But again, all of that has to be thoroughly explained within the study submission, and all 3 of the following criteria has to be met for the Carillion Clinic IRB / the Privacy Board to grant this waiver.
There is another pathway, decedent research. So, in this case, you have to document that the use is solely for research and that the PHI is necessary for the research, and you also have to provide the documentation of death. And then when that data comes over to Virginia Tech, again, it's not regulated by HIPAA at that point. It's information subject to state and federal regulations and university policy. There is, a pathway for preparatory for research. And in this, you'll see that this would be used by a researcher when you're really, a good use of this pathway is when you're really trying to look and see if the research you want to conduct is feasible. Are there, maybe you're writing a proposal and you want to know, are there enough people in this area with this condition, would it be feasible for you to conduct your research? So with this pathway, the data actually stays at the covered entity and never leaves. So, and it, is protected health information regulated by HIPAA, but the Virginia Tech researcher can be granted access. Again, it never leaves, and the non-covered entity does not contact the patient. So you might look and see that there are, in fact, a number of people in the area that would meet the criteria to enroll in your study, but the Virginia Tech researcher can't reach out and then, and send them recruitment materials. Rather, the current method we would use would be that the covered entity, in this case, Carillion, would reach out to the potential participants on behalf. And then if they were interested in participating, the letter that they would receive would say, please contact the Virginia Tech research team. Another pathway for moving information is the business associate agreement. As I mentioned in the earlier slide, this is really for when Virginia Tech is performing tasks on behalf of the covered entity. And as you can see, if the data comes over to Virginia Tech through a business associate agreement, then it's protected health information regulated by HIPAA once it is here. And this is not a recommended path for research at Virginia Tech at this time. I think sometimes people start going down this path. Covered entities tend to be more comfortable with this path, and will be working to collaborate. But I think it's really important that researchers at the proposal phase know that this is not a recommended path.
So, as a recap, we've been through a lot of information that includes understanding the regulations and the laws that deal with HIPAA and PHI. And one important thing to note, especially since you're attending, is you have the desire to do a collaboration, and we're very excited about that. But I wanted to also do a reminder for planning purposes that there's lots of steps we've already covered with that. And so one of the most important steps with a collaboration is early communication, especially between Virginia Tech's IRB and Carilion Clinic's IRB. With that being said, from the beginning, when you are aligning your missions and your core values to work with Carilion Clinic and Virginia Tech, that is when the early communication should start, because part of your study submission is in section 9. You will have to explain the collaboration, who is going to do what are their tasks, the delegation of information, and also the principal investigator or co-investigator will be a Carilion Clinic employee. And so these are just important things to note. We hope at this time you're taking notes, and it's a good recap and just a reminder that to go through all these steps and the pathways, you may have determined it, but part of that planning is also preparing Virginia Tech's IRB and Carilion Clinic's IRB for these studies to come.
I'm gonna start with a frequently asked question I get from Virginia Tech researchers. So I will have Virginia Tech researchers, maybe they're not working in a collaboration with Carilion, they're in their own lab, and they are collecting survey data and that asks people sensitive information about their health. And I see a lot that they're saying, oh, I'm collecting HIPAA data. So they're saying, do the HIPAA regulations apply to my data? The answer is no. We call this data research health information. It is sensitive. It absolutely needs to be protected, similar to the data we might receive from a covered entity that's de-identified or, through a limited data use agreement. We absolutely need to be protecting that data. It isn't, that the data doesn't still require really stringent technical, administrative, and physical controls. It's just that it's not regulated by HIPAA. And we're trying to clarify that with our researchers. The common rule is regulating it. Like there are state laws that protect certain types of health information. So again, it is absolutely critical that we're protecting this data, but it just is also important that we're not flagging it as HIPAA regulated data. I think at this point, if we have other questions, we do have a list of frequently asked questions we can run through, but if anyone zooming in has any questions, we also are happy to take some questions at this point.
Do feel free to take yourself off mute if you have a question, or you could put your question in the chat and we'll be happy to read those out. I don't see any questions in the chat just yet. Maybe if you all would like to go through a few of those frequently asked questions, that would help.
Okay.
So to sort of echo Julie's previous frequently asked question regarding, HIPAA regulated data and when is a researcher considered to be a covered healthcare provider under HIPAA? And this can sometimes seem a little gray, but I really want to focus on the example at the bottom. A researcher who conducts research that involves the delivery of routine healthcare, for example, MRI, liver function test, and transmit health information to a third-party payer for payment. So it involves treatment, routine costs that you are billing for. You are considered a healthcare provider under the HIPAA privacy rule with this type of research. And just acknowledge that there is a lot of research that is done that may not involve these sort of routine healthcare delivery, like Julie said, survey data, but it may be about your health, not necessarily HIPAA covered data. However, most often at Carilion Clinic, we are dealing with HIPAA regulated data because it's coming from the medical record. So a big difference there between our two entities as it comes to HIPAA regulated data.
I will add, I think that one component of this is this, you know, what you can actually go to that next slide.
Sorry.
That's fine, yeah. That, you know, if you're a Virginia Tech researcher with a joint appointment at Carilion and you're doing, you know, surveys at Virginia Tech, are you, you know, covered? Are you doing that as a covered entity, and is it protected health information? Really, when you're doing, when you're both, and you know, you have a foot in both worlds, it is really important that the IRB and you know, Carilion IRB and Virginia Tech IRB and myself, we can release it down. It's really it's dependent on the research and the tasks and the way it's been set up. And so at that point, it's really fact sensitive, and we can do an individualized determination to separate out the different components and what is and is not, you know, and what, you know, should the data, where can the data live? Does it need to stay at Carilion? Can it come over to Virginia Tech? So those are, you know, if you're in that position, please reach out and we can sort through.
This next frequently asked question is sort of a recap of what Julie went over in previous slides regarding use and disclosure of PHI for recruitment purposes. And so PHI, or excuse me, Hillary and Julie's slide likely touched on this too. PHI can be disclosed for recruitment purposes if a HIPAA authorization has been obtained and signed, or if a waiver of the HIPAA authorization has been granted by the IRB. An important note is that treating providers under a covered entity may discuss with their own patients the option of enrolling in a study without a HIPAA authorization or waiver. However, the treating provider cannot disclose that information to anyone else for the purposes of recruitment in a research study without an authorization from the patient to then share that information for research purposes. So a key point is that researchers who are not treating providers of potential subjects, they can in turn request referrals of eligible patients from treating providers.
This is kind of on the non-covered entity side. We often see IRB submissions or consent forms that say, you know, we're collecting your data using a software that says it's HIPAA compliant, you know, like Qualtrics or QuestionPro is HIPAA compliant. And so they're making sure they tell participants and sponsors and, you know, proposals or on consent forms saying, oh, things are HIPAA compliant. Just want to caution that telling participants that the data are collected and processed by the research team are HIPAA compliant can be misleading if you're with a non-covered entity. When you read the fine print, you know, it will be. If you look at Qualtrics or QuestionPro, they do flash things like saying, oh, we're HIPAA compliant, GDPR compliant. But when you read the small print, it does say it's HIPAA compliant with respect to a covered entity. You know, we offer a platform that enables covered entities to collect and manage PHI through surveys while being compliant with HIPAA. So that language isn't, you know, 100% accurate there. It's still the same, might still be the same protections. And I think that's something to note. Again, we really want to protect the data. We want to be using tools that are secure and have the protections in place, but labeling it and mentioning that, you know, it's HIPAA compliant is not accurate.
Hillary and Julie, I see a question in the chat from Heather Mason. Is email the preferred way to request the consults with the IRBs and PRDP for the individualized determination? Do you want to take that one?
I can speak for the Carilion Clinic Human Research Protections Office. You are always welcome to email me, or we have an office email that's irb@carillionclinic.org. And we are happy to filter your question or even set up a consult with one of our submission analysts, the ones who look over applications or even can help you kind of route in your studies and what path to take or if you're on the right track. We don't do any determinations by email or by phone or anything. It really is dependent upon a total review of all sections of the application and any further explanation. But we're always happy. The easiest way is to email the irb@carillionclinic.org. And we're happy to either set something up with our office or even myself or direct you to a different department in research at Carilion.
And I would say at the Virginia Tech side, starting an email to the IRB, it's irb@vt.edu. That will they will bring me into the loop as soon as they see some keywords. And I think that is, on our side, and I know that in the past we've had consults that include both a representative from the Virginia Tech IRB and the Carilion IRB, just when it's complicated and really, a discussion about how to move forward or if there are questions. But yeah, I think the best way to start the process and is to request a consult with IRB.
Did that answer your question, Heather? Any other questions right now? Or even if somebody else wants to pop into the chat?
Heather said yes in the chat.
Great.
If no other questions right now, we can jump to this frequently asked question, which Julie did touch on earlier, in regards to preparatory to research provisions under the HIPAA privacy rule. So just sort of reiterate that under the HIPAA privacy rule, we can use PHI for the purposes of preparatory to research to aid in study recruitment. Often it's to make sure we have enough people with XYZ condition to make sure we can actually successfully execute that type of project. However, it does not permit for that data to be removed from the covered entity site. So a big takeaway there is that, collaborators cannot use the preparatory to research provision to contact potential research subjects.
I see another frequently asked question is, if we're receiving, a Virginia Tech researcher is receiving from Carilion or a Virginia Department of Health or another covered entity, providing me with an existing data set to analyze for research purposes, is this data set regulated by HIPAA? Generally, the way we're reviewing and negotiating contracts now, no, HIPAA establishes the conditions under which the Department of Health can provide the data set. But once Virginia Tech has a data set, we protect it, according to federal, state laws and university policies in place. Now, again, as in previous slides, if Virginia Tech were to enter into a business associate agreement, the data set would be, and this currently is not an option at Virginia Tech.
So what happens when a research participant revokes their HIPAA authorization? Can a researcher continue using the information? So a researcher can only continue to use and disclose the protected health information that was obtained prior to the time the participant revoked their authorization as necessary to maintain the integrity of the study. So I want to drive that home that it's all about what is necessary to the study. And then again, after any sort of data gathered by the covered entity after the participant revoked their HIPAA authorization for the study cannot be used. I'm seeing another question in our chat is that from Dr. Fintel, our cancer patients need access to clinical trials and innovative therapies. I'm so happy to see your teams deliberating, laying out how collaboration will occur. Blue Ridge Cancer Center is a group of oncologists also eager to be a part of this process, and Dominion Pathology Associates. How are these outside entities being considered? Great question, Dr. Fintel. So I know I can speak on the Carilion side, but we're really looking to expand our collaboration, not just with Virginia Tech, And, you know, one of those ways is getting with the IRB. I know reliance agreements, do take time. And then additionally, you know, we are working with all the stakeholders, including compliance, the IRB, our health analytics research team, to make sure we have all these pieces in place. Also the research office of research and development to make sure we have feasibility and staff involved, to be able to execute these trials. So good resources for you in wanting to kick off some of these collaborations would be the IRB and our Office of Research and Development. These things are on the forefront. We are wanting to grow our research portfolio and expand our collaboration. Hillary or
They
Charlie,
have
did
a
you wanna
seat
add
at the table now. Are they at your meeting, your collaborative meetings now?
Well, that's what I was going to say. As I scrolled through the attendees, I know that there are several leaders that are in attendance today who see your note, and I'm sure will be happy to reach out to you, Dr. Fintel. As I scrolled through, I saw that some are present, and so I'm sure they're taking note and will contact you directly. And if not, I'm happy to also pass along your message to the correct people as well.
Yes, I know Francis is on the call. Did you want to chime in, Francis?
Yeah, this has been an excellent presentation. And what I really like about it is you could replace Carilion Clinic with any covered entity in the Virginia Tech with almost any other institution. And these slides would make perfect sense except for that MOU. Maybe what Dr. Fintel is getting at, what are some of the subtlety differences when it's two covered entities wanting to collaborate?
Two or even three.
Yeah, Bill, most of your folks, this is Charlie Schultner,
I was
most of the
gonna say-
folks at Blue Ridge Oncology also have appointments or privileges at Carilion Clinic. So that bridge really makes things much easier for your group. I think that
My
doesn't that
former
sound
group.
much your concern?
Well, I know that just recently we banged heads a little bit in the legal department trying to, it had an issue of indemnification, and I keep trying to ask for some grand umbrella agreement rather than a series of hundreds of small agreements and umbrellas to do research. There's a lot of people who are going to be part of this team, and going forward, and you know, over my shoulder, we're going to have a cancer program. All these people are going to be in it, and I love this conversation. I just want to make sure that there's plenty of seats at the table for all.
You know, we have so many unique complexities here, and I'm sure you're aware of that. I know Francis is. It creates new ways to fashion and relieve those impediments, no question.
Yeah, a lot depends on the PI of the clinical trial and what IRB that PI reports to. Because Dr. Sluber, it's my understanding that you really aren't part of two different IRBs, right? If you're a Carilion Clinic employee, you're with Carillion's IRB and vice versa.
That's true, but you know, the people at Blue Ridge Cancer Center are an interesting bridge because they do have their own, through US Oncology, their own IRB available to them in addition to ours. Most of their chemotherapy, if it's on study and it occurs as an outpatient, would come under, as I understand it, it would come under the US Oncology IRB. Whereas if it involves inpatients, it's going to fall under our IRB. Bill, is that not the way you understand it?
I'll just throw a caveat in. We're now doing a collaborative agreement, but the therapy is not the giving of chemotherapy is not a research piece. It's standard of care. When there is a drug that is experimental, I don't know that BRCC can do that unless it's done in our infusion center. So these are just complex agreements that I'd love to have a lot of the stuff ironed out, and then we can start looking at trials for our patients. And remember, I mean, these cancer patients need this stuff tomorrow. If my cancer isn't responding to the 4th line of therapy, I want a 5th line. And if it's not available here, and it is at Wake Forest, I'm going to get in my car. So that's the importance of this.
Amen. I agree with you.
Andrea Moore has a comment you might want to read.
Yes, thanks, Francis. Dr. Fintel, Andrea Moore, our Director of Clinical Trials here at Carilion, added in the chat that the MOU with Blue Ridge Cancer Center addresses various types of collaborations. Some agreements have to be protocol specific. So I think I can speak for all of us that we're happy to keep working through any of those agreements that have to be protocol specific. And we are all, in agreement that we do want to keep these collaborations going as they do fall in line with Carolion's mission with improving the healthcare of our patients in our areas.
I'm going to jump to the next slide, Katie, with my project path is a good one to talk about.
And great discussions. I'm really enjoying this presentation today with everyone.
And for those who didn't know, Dr. Sloopner that spoke, he is actually the Carilion Clinic IRB chair. I did not want to call him out earlier, but that is who spoke, is Dr. Charlie Sloopner. So thank you.
Yes, and then thank you, Francis, our Director of Research and Development here at Carilion Clinic, for adding some key points. So as our Carilion folks, our Virginia Tech folks, or any collaborator from any other institution navigates research at Carilion and collaborative research, the health analytics research team has developed a resource to provide you with as much or as little information as you need. It's called My Project Path, and there's a link on our slide, and I'm actually going to drop the link in the chat where you can just navigate yourself through different oh, it looks like that link didn't work. I'm sorry. It has a bunch of resources for you all, whether that be, what different project types, whether it's research, QA/QI, clinical trials, what approvals you may need, details about our HRPO, IRB office, and lead times with submissions. Thanks, JT. And who is our health analytics research team, details about Trinetics, our innovation department, the Sim Center, Epic Abstracts, working with collaborators, REDCap, ERA Commons, case studies, clinical trial support, presentation, poster templates, assistance. So really just a slew of resources for you. This is a live link available to you all to go into and explore. Carilion is working to continue to develop this resource for you all and add new information as we grow and expand and as we try to address the needs of getting these resources out to you all. So I encourage you all to go to this link, share the link with your collaborators, your research fellows, and feel free to contact me or Hart on any sort of additional resources you may like to see in My Project Path, and we can see if we can get that in there.
And we loved working with Julie on this. We all really were glad to collaborate together and found a passion. So Julie, if you want to add anything.
No, I agree. It was great. Originally when we first met, we were talking about, I would do my slides and then, Hillary would do her slides and Katie, but we were realizing we're all kind of in it together. So we wanted to mix them up and kind of address all the issues throughout. And it's been a great, just putting the presentation together was a great collaboration. And I'm looking forward to continued collaborations like this.
You guys integrated it very well, I think.
Thank you.
Thank you.
It has been such a pleasure working with Julie and Hillary on this. We know, as we collaborate, it's not just one side versus the other. We are coming together for the collective goal, and that's how we wanted to approach this presentation. So we're looking forward to doing more like this in the future, especially as we expand on collaboration and navigate through our growing research enterprise.
Especially through the planning purposes. So this really helps with putting ideas together and asking the questions for consults. So we hope you enjoyed it.
I want to ask you guys about a scenario. Okay, I'm a healthcare provider, let's say at Carilion Clinic, and I have a significant other that's a Virginia Tech researcher. I would love to get them to know my patients that would be perfect for this trial. What can't do in that regard?
You want your patients to be aware of the trial that your significant other is doing
At Virginia Tech.
at Virginia Tech, so, and you're the treating provider, correct? Well, you can, as a treating provider, you can provide them with details of another study and then point them, give them their recruitment details. And Hillary, if you want to chime in from the IRB standpoint, and it also, or an alternative would be the patient's consent, HIPAA consent to then release information to Virginia Tech. Hillary, any additional points you want to add?
I don't think any additional points. I would say Dr. Sloopner, if you want to.
Yeah.
Francis, were
I
you-
saw him laughing. I thought he was
well,
Dr.
didn't you
Farrell's
say
throwing a
significant
curveball.
other?
And
Francis, didn't you say my significant other is at Tech and she's
Yeah.
doing a project? And-
Yes.
yes,
Yeah, I was about to say, don't talk across the dinner table.
right.
I think you understand. You could, I think as Katie said, you could expose a patient to the fact that there's an ongoing study at Tech, but those would be volunteer studies. And then your significant other could handle that. They wouldn't be going there as a Carilion patient, but as an external volunteer.
Mhm.
Well, what we've been talking about is very different from that, as you know. I like the curveball you were throwing.
Right. He waited until the end to throw that in.
Well,
Uh,
and I'm thinking on that end, right, the IRB record would be the Virginia Tech IRB because the significant other is an employee only, I was assuming, of
Amen.
Virginia Tech. So they would have just gone through Virginia Tech IRB. If they're using that as a specific recruitment method, that would need to be detailed in their, I don't know that would fall under word of mouth, right? I mean, we have to think, they would have to think about that if this was specifically how you're recruiting versus is it just, oh, I'm posting flyers and someone who I know who happens to be a spouse or a friend said I could post it in their clinic. Like those are, on the Virginia Tech side, your recruitment materials would need to be approved and your methods would need to be relayed to the IRB.
Yeah, you guys would need to know about that.
Right.
Have to be documented in writing.
Great answers.
What? I felt like we were just getting tested there at the end, really.
I didn't have a prepared response for that one.
Yeah, I saw Dr. Sloopner laugh immediately, so I was like, well, I'll let him build that one. All right, well, if there's nothing else, we really appreciate y'all's time and maybe sharing your lunch with us. We hope you enjoyed it.
Yeah, great job, ladies.
Thank you all.
Thank you.